Hey everyone, Dr. Dale here. I want to speak on a subject, the subject of cancer, and specifically cancer testing. So like mammograms and prostate checks, cancer screenings. And I want to talk on specifically the PSA test. So men out there, I want you to pay attention. Wives, you need to get this video to your husbands. You need to make sure they watch it, especially if they're 40 years and above. So I'm looking at this. I'm reading from an article that touches on the United States Government Task Force, the Preventive Service Task Force, designed or brought together and put together by our government to evaluate whether screening methods, drugs, certain medical interventions, to find out whether they even work or not. So here we go. Again, the United States Preventive Service Task Force regarding prostate cancer screening. It now says, men of all ages who haven't been diagnosed with prostate cancer shouldn't get the PSA test. So that's your test that you would go into your doctor with and get your PSA test. That's a prostate-specific antigen test. They're now saying you shouldn't get that test unless you've already been diagnosed with cancer. So men, if you don't have prostate cancer, you haven't been diagnosed with it, you're not supposed to get that test anymore. And what they're saying is the guideline, and this is quote directly from their website, the U.S. Preventive Task Force website says, the guideline is based on science and rooted in the knowledge that while everyone wants to help prevent deaths from prostate cancer, current methods of PSA screening and treatment of screen-detected cancers are not the answer. So I want to sum this up real quick here. This test is not saving lives. In fact, the treatments that we're now utilizing, such as hormone drugs, the surgeries, the radiation, these things are harming men faster than what the cancer even would. So where do we go from here? Obviously, we want to save lives. We want to see less people die of cancer every single year. That's our goal, and that's my goal, especially being a maximized living doctor. So where do we go? What we need to do is turn to the things that have already been proven, already been shown to have no harm, but have massive benefits. And what is that? It's major lifestyle changes. It's, in my opinion, and what I've seen in my office and across Maximized Living, it's the Maximized Living 5 Essentials. That's your mindset. That's taking care of your nervous system. It's taking care and eating properly, your proper nutrition. It's exercise. Cancer can't live in a well-oxygenated environment. And then the fifth is detoxing. Those are the factors that will determine whether you develop cancer or not. So if we can focus on those 5 essentials, getting you healthy, that's how we're going to finally see the lives of men saved from ever developing or ever dying from prostate cancer. So I want you to join us. October 5th is Maximize Living's Cancer Killers Workshop and Makeover. Join us. If you want information for your local Maximize Living office, go to maximizedliving.com. Or if you're in the Clarksville area, I want you to visit Marathon Chiropractic's website, maximizedlivingdrbrown.com, or call us at 931-591-2010. That's 591-2010. If you want to learn those 5 essentials in detail on what you can do to reverse cancer, or never even need to rely on a test to detect it when you already got it,